Dr. Joy Kong, when you look at the world of stem cells, people think you have to go to Mexico or you have to travel around the world and go to some sketchy clinic somewhere. But the fact of the matter is, it seems like it's doable stateside in probably a safe and possibly even more effective way. I mean, you do this in your clinic, and I'm curious, like, what is the difference between what the FDA and is allowed and regulated in the United States compared to what happens in other countries?
Yeah, so much to unpack there. The FDA basically says that if you start to change the cells in any way, then you are creating a drug. But if you're taking a cell from one human being's tissue and processing it and doesn't change the cells in any way, you can give it to another human being, and that's considered a tissue transplant. That does not require a drug approval. So when you ask people to get a drug approval, that means that they have to go through animal studies and clinical studies. It's very costly, very laborsome, and there's a lot of hassle. It takes years. So a lot of these clinics, they don't want to do that. So they go overseas because what they are using are cells that are expanded, which means they're put in a culture medium and in an incubator to grow the cells to huge numbers. They were trying to adhere to the research protocol that used large number of cells that were expanded. So now they're following the same track. They think that you have to expand the cells and give people a large number, 100 million, 300 million cells to exert certain benefits. But what's interesting is that because the FDA has this rule in the US, so in the United States, we can only use cells that have not been expanded. So they are native cells. They're the same as what we've gotten out of the patient's body. And when you use those cells, you actually don't need as many cells because you haven't changed the cells in actually not just growing them in numbers, you're declining their capabilities. So they're actually less potent and they express more inflammatory markers and they cause more rejection type of reactions. So even though you're giving people a lot, but you potentially are lowering the benefit. And in the US, even though the FDA kind of at first seems like it's making things more difficult for doctors to give stem cells because you can't give as large of a number, but because of this rule, so many clinics are using these native cells and finding incredible results. So this is like kind of a new development in science, right? Now we've amassed all this clinical evidence using cells that are native, haven't been expanded. And then when you compare the results of these native cells with what people are getting overseas, which are all expanded, anywhere you go, Mexico, Panama, Costa Rica, Colombia, they're all expanded. And what I've seen in my clinic is that the same person can be getting a treatment in Mexico or Panama, and then they come to me to get a treatment where I will give them much less number of cells, maybe 1/5 or even 1/7 the number of cells, and they're achieving better results. So it's it's passed down from tradition and from the FDA regulations. That's why all these companies are overseas, but doesn't mean that what they're giving people are the most effective.
Now, after this video, I put a link down below for 40% off Sundays. Now, I have 4 dogs. I'll tell you, we feed them Sundays because it's human-grade dog food. So that means it's good quality food that a human could eat themselves. You might be wondering, this is really random to have a commercial for dog food on a health channel. Bottom line is, this channel is also about my life, and I talk about things that I use, and that's how sponsors come on this channel. So that is a 40% off discount for Sunday's human-grade dog food. It was formulated by a veterinarian that really saw a serious need to feed higher quality food to our dogs. So that link down below gets you 40% off. If you've got pups and you care about health, it's probably an interesting fit. Check them out down below.
So are they essentially just giving them stem cells that are just kind of proliferated into their, like, just to a massive amount? So, I mean, you really, in some cases, don't know what you're getting. Is that what it is? Or you're not getting your own stem cells, right? You're getting, like, basically...
Yeah, so most of these places are using umbilical cord-derived stem cells. So 8 years ago, when I first got into the field, majority of the stem cell therapy were using a person's own, so either bone marrow or fat-derived stem cells. But then the umbilical cord cells, these are newer on the block. So these are from live healthy births. So when a baby's born, the cord is cut, usually they're tossed. But now we can utilize them, getting cells out of them. And now we found out by direct comparisons with a person's own stem cells, which is usually a person's own age, right? 20s, 30s, 60s. So when you get cells that are older comparing to cells that were from a newborn, not just a newborn day 0, but actually younger than day 0, because the cells from the umbilical cord were trapped while the embryo was forming. So it retained a lot of the early embryonic characteristics that has been lost in the newborn baby's body. So it's in between the embryonic stem cell and the baby stem cell. So it's very early in origin. When you compare that with the cells from a person's own body, there's really, it's the results are pretty resounding. I have a lecture on YouTube says, are all MSCs created equal? Because I gave people the evidence from around the world, people actually researched. So we know the umbilical cord source is actually superior. More growth factors, more neuroprotection, longer generations left, more differentiation potentials, more ability to fight off cancer instead of promoting cancer from a person's own. So there are all these parameters which shows umbilical cord source is superior. But then within the umbilical cord, there are all these camps. There's cord blood camp, cord tissue camp. There are people who are using amniotic membrane, people who are using placental. So, and then there's the camp of people who are using native cells, which is what I use, cells that have not been expanded and grown. And there's the camp of overseas, where people are growing the cells in the incubator. So when you are looking at the cells that have been incubated, then the potential of side effects is accumulating. So these are the different camps.
So if you're going to use a native cell, if I were to go to your clinic, then what are you just pulling it from marrow? What are you doing? How are you getting it?
Yeah, we get it from FDA registered tissue banks.
Got it.
So
okay.
These are laboratories that contract with, there are procurement companies. All they do is go to different birthing clinics and hospitals and to get consent and to qualify people into the donation. And once they get the tissue, that's when the lab process it. And so in my clinic, I have a proprietary formulation because I use cells from the different compartments, the cord tissue, cord blood, amniotic membrane. So I combine different compartments together because these have different cell populations, but also they have different growth factor profiles. So they have different types of cells and even the same type of cell, let's say mesenchymal stem cell, the most popular cell type, even when it's that particular type of cell, if they come from cord blood, it's very different from if they come from the cord tissue or amniotic membrane, which is why I'm combining all of those together. So then I specify what I want from which compartment of the cord I want, and the laboratory will produce it. And then by the time, so they will cryopreserve it after processing. So anytime I'm ready to give it to a patient, I just quickly thaw it out and then somehow put it in the patient's body.
So what are some of the main reasons that people are trepidatious with stem cells? You hear like a lot of people just don't want to do it for whatever reasons. Like is it a safety concern that people have? Is it cost prohibitive? What's the main sort of roadblocks for people? Because it seems like the evidence is so strong, and the anecdotal experiences are so strong. It's interesting. I know it can be expensive, but it seems like there's a lot more barriers for people, maybe psychologically than.
Yeah. I definitely think one of the major barriers is cost. So that there's a whole other, that's other subject, but comparing to medications and hospitalizations, or even certain new therapies like immunotherapy that's funded by the drug company, or gene therapy, drug company funded, they charge hundreds of thousands of dollars, believe it or not. But, compared to those, it's actually not that expensive considering what it's doing for your body, actually reversing the age of your cells and literally dialing back the clock, erasing the years of damage on a cellular level. So that, cost is one thing. And then the other objections I've heard, one is, and people are concerned, can this exacerbate cancer? So my answer is that depends on what kind of cells you're using. If you're using cells from your own body, your own cells have been with you for your entire life, and everything you did, all the alcohol you drank, all the toxic exposure you've been exposed to, bad food, everything can manifest in some ways in these cells. So they have gradually lost in their potency, not just potency in how much activity they can generate, but also their intelligence, whether or not they can recognize cancer cells. So they've done direct comparisons of looking at umbilical cord-derived mesenchymal stem cells, MSC for short, versus fat-derived MSCs. And they put these cells next to glioblastoma, right? A very virulent form of brain cancer. So these tumors, they put it next to the tumor in both petri dish and on a live animal's body. In both cases, the cancer cells exposed to the fat-derived MSCs kept growing and expanding, right? Just tumor got bigger and bigger. But the umbilical cord MSCs, when that's sitting next to the cancer cells, those cancer cells actually start to die away and the tumors start to shrink. So you really have to look at what are you getting? Are you getting a source that contains the full intelligence to detect cancer and having the skills and the capabilities to actually send signals to tell these cancer cells to die? So that's another big difference. Another objection, I've heard some people, they were concerned about, I don't want to put other people's cells in my body. I don't want other people's DNA. So, I mean, really, the thing is, you have to look at the risk versus benefit profile, and also really how much risk is there. First of all, people may not be aware that as human beings, we carry each other's DNA. I mean, they don't know, but they did research on women. 60% of women actually have Y chromosomes in their body. And they couldn't figure out how that is the case because they were looking at women who have maybe given birth to male children. And then there's DNA exchange. And women who may have had miscarriages that no one knew about. And they were looking at statistical calculation to account for that portion. And they were looking at possibly these women may have, while they were in the womb, they may have had male siblings that somehow died away that no one knew, and there were DNA exchange there. And then after analyzing all these possibilities, they realized that we can account for 60% of the women having Y chromosomes. And the only conclusion is that through sexual intercourse, that there's DNA exchange. So just know, if you have sex, you might have exchanged DNA with other human beings. So it's not such an esoteric, such a drastic and scary thought. We carry other humans' DNA with us throughout millennia. The whole time we've been around in the world. We also carry the DNA of all kinds of things, right? Probiotics, all these different critters that live with us, good or bad. So that's kind of a part of who we are. We are a walking universe. We contain a lot in us. The second thing is, first of all, is commonplace. Second of all, is how many of these cells I'm giving you actually will end up becoming you. First of all, there's a possibility because we've seen human stem cells given to animals end up living in the animal's body forever until the animal dies and existing peacefully, right? Human cells on an animal's body, like they've shown on skin. So, it's not like it's catastrophic that you have another species something in your body and that has to cause problems. But so between humans, there's going to be very little problem. When you give human a young stem cell, that cell has the capability of working with you. When it's older, it's less adaptable. It's just less willing to work with a new host. This can be shown pretty clearly in this example. Let's say people have leukemia, and then they get chemotherapy, and they need bone marrow transplant. You have to look for a perfect match. Almost ideally, you want to look for a perfect match of somebody so you can get their bone marrow to be transplanted to you. But even a perfectly matched bone marrow transplant can cause rejection. There's a chance of rejection. Because the body is so complex, just because you've matched what you know as the things that you need to match doesn't mean that's a whole spectrum of all the things that can cause problems. But if you transplant umbilical cord blood. So this is from the cord, right? From when the baby was born. The composition of the cord blood is very similar to the composition of bone marrow. So one of the only FDA indications for stem cell therapy is using either bone marrow or cord blood to do hemoreconstitution, to replenish the bone, the bone marrow or the blood generating system. So, but you can use somebody's cord blood completely unmatched, and there's less side effect than a perfectly matched bone marrow transplant. So that just shows you how younger cells, how different they are. It's not just the age, but it's their adaptability.
If they were using, say, their own stem cells, and they lived a life of just gluttony and abuse, and would they have a lesser chance of their own stem cells taking, in that particular case? Or let's say someone that really paid attention to their health, and they had just healthy tissue, healthy mitochondria. There's a healthy person, right? And they maybe had an injury and they wanted to use stem cells for an injury specifically, maybe less on the, quintessential sort of anti-aging. Is there any evidence to support that a healthier person using their own stem cells would have a greater benefit than an unhealthy person using their own?
Well, first of all, the terrains are different, right, between these two people. Sure. The healthy person will have a easier terrain. So the cells may be more comfortable, that there's, a more friendly environment for the cells to function better, because toxic environment is going to be toxic to all cells, including stem cells. However, when a person has a lot of inflammation, this is why I'm not advocating to patients that you have to calm down your inflammation before you get therapy with me. It's not the case, because research I've shown, if there's a lot of inflammation and disease activity in the body, it actually triggers the cells to work harder. So the cells can actually spring to life even more. So you don't need to calm everything down, put out a fire before you bring the firefighter, right? Bring the firefighter to help you put out a fire. So that's one thing. But also, if you have a poor lifestyle, you've been not very kind to your body, then you're going to have a lot of problems. So, and there's only so much a group of cells can do. I can give people a bolus of stem cells, but if you got fire spread throughout your body, then it's going to take a lot of cells. It may take more sessions to get the same benefit. So, but if a person has an issue, first of all, let's say a person that didn't treat their body very well and got a knee injury. And then another person that has done everything right and also got a knee injury. So out of the two people, I can give stem cell treatment. They could both achieve phenomenal result, but sometimes it's a little harder to figure out where the cells are going to go when it's a person that has the less advantaged terrain, right? Because there may be a lot of fires to put out. So the group of cells may not end up going to the places that you want them to go, because there's so many places screaming for help.
Is there a chance that a very healthy person with low inflammation, when you take in the stem cells, ultimately the body's just no, we don't see a demand, there's no demand, so there's going to be more of a die-off and less overall differentiation? I
don't think there will be more of a die-off. You may not see as drastic results, which I've seen in our anti-aging patient population, which includes myself. I don't really notice. I've been doing IV stem cells on myself every 3 months for the last 8 years.
Wow.
So I don't really notice anything for the most part, but doesn't mean that I don't have the faith knowing what these cells can do, because I've seen the research. I've seen how it actually transformed an older animal cells back to the younger state. So I'm doing this based on my faith in science.
Yeah.
But I think, even if you're very healthy, your aging process is ongoing.
Sure.
So that's why we start to, decline, right, in our physical stamina, in every aspect of our lives, including how we look. So there's the aging decline. Do you want to address that decline? And that's where we really have a chance to reverse the age and keep a person younger longer. So our goal is for a person to have a very extended youthful time and die still in a youthful state, without being diseased.
What's your take on PRP? And I ask this just because that's people say, okay, like stem cells are cost prohibitive for them, so the next thing they kind of look at is PRP. I'm just curious your overall take on that. Is it something that's viable? How does it work?
Yeah, I definitely like PRP. So PRP is platelet-rich plasma. So we can draw a patient's blood and then spin them down, and then you get a portion of the plasma that's rich in platelets. So platelets are really helpful in wound healing and releases a lot of growth factors. So you can definitely use that for all kinds of healing. What I say is that, if you want to make analogy, it's like a stem cells is like a PRP on steroids. Mm-hmm. So the practitioners who have used PRP and then later on tried stem cells, they all agree that if the PRP doesn't work, then we're going to use stem cells, because the stem cells will produce more drastic, more response, higher benefits, and also with longer lasting benefits. So I often combine PRP with stem cells for local injections, because I want to give more signals, all these growth factors. I want to harness those potentials. And also PRP is nourishing for the stem cells. So it's almost like food for the stem cells. So allow them to be more nourished. And then also when I inject into a space, let's say a joint space, PRP has a little bit more scaffolding, more matrix, and that help the cells to stay in place a little better. And they also give me more volume when I inject into certain areas. For example, I do paraspinal injections and I want the cells to spread. And if you have enough volume, not just volume, but with all these growth factors, they can help carry the cells to a greater area, covering more fascial layers, which is where most of the pain come from. So you can utilize in these ways.
Interesting. So is it true that generally people that have, because like PRP, they said, I believe I've heard, and I don't know if it's factually true or not, that is a situation where typically healthier people have a better response with PRP. Mm-hmm. I have never done stem cells. I have done a PRP infusion called TrueDose. Have you heard of TrueDose?
No. You did an infusion.
Yeah.
Okay.
And it was like 3 months of bliss. I felt amazing. And it was, just felt like my inflammation's pretty low, but it felt like it was taken to a new level. I felt so good, like everything but it only lasted like 2 or 3 months. And then things kind of like the traditional level of sort of stiffness that comes being an athlete kind of came back and stuff. Mm-hmm. This is just can be kind of your opinion. I'm curious. So if someone responds pretty well to PRP like that, is it usually an indicator they probably respond well to stem cells?
Well, I haven't met a lot of people who have done that PRP infusions, but sounds like your body, you're pretty sensitive to the, how your body's working. I think definitely then you will have a higher chance of seeing, more pronounced results. So I don't think I'm very sensitive at detecting different, aspects. I can take all kinds of supplements. I most of the time I don't notice anything, but a lot of people, I think maybe you are more sensitive to what you put in the body. But some people notice more, some people don't, but it doesn't mean the cells are not doing some amazing work. So I don't notice it, but as people who I met, or people in my life, or my neighbors who are commenting, or people I don't see for months, and when they see me, they say, "Oh wow, you're looking younger than the last time." So it's these things that I gotten external kind of feedback, but I think more sensitive person like you may notice more. Yeah, and more like a personal capability of sensing.
Yeah. What about from a cognitive perspective? Because I think people think stem cells, and they just think the body. Are there benefits for stem cell treatments when it comes down to cognitive function, when it comes down to just brain health in general?
Yeah, absolutely. So the brain is just another organ. We have used stem cells to help patients with all kinds of conditions of the brain. So traumatic brain injury, Alzheimer's, Parkinson's, MS, ALS, so autism, all these are brain issues. I think there's a whole body component to it, but definitely the way we help the brain, also we want more cells to be delivered into the brain. Actually, just IV delivery of the cells can do tremendous benefit, because it activates your immune system, and your immune system is crucial in how you fight the aging process and fight any disease process, really. So because the IV cells can get to, one of the first places they go to is the spleen, which is an immune organ, and they can get to all your peripheral lymphoid system. So they activate your immune system, which can mount all these repair mechanisms for your whole body, including the brain. But we also want to improve the access to the brain. And we do that by giving a infusion, mannitol infusion, to open up the blood-brain barrier more. And then we can also do intranasal procedure. We can inject the stem cells into the nasal membrane, and that will get uptaken by olfactory and trigeminal nerves into the brain. Is pretty fascinating. Or we can use exosomes, which, intranasally, and that gets uptaken into the brain very easily. So there are different ways to access it. But definitely, I think cognition is a manifestation of the health of your brain, of your brain's ability of all your cells to communicate with each other, right? So if you can enhance the health of the cells and they have better communication, then your cognition is going to improve.
Yeah, definitely makes a lot of sense. Well, Dr. Joy, where can everyone find you?
I have my clinic, Chara Health, in Los Angeles. And the best place to find me probably is on YouTube, my channel, Joy Kong MD, where I give a lot of educational content. And I have a podcast, the Dr. Joy Kong podcast. I interview a lot of wonderful people. And my website is joykongmd.com. That actually has information on everything I'm into, which will be my own clinic, the stem cell company I founded, because we produce the stem cell products and then send it to doctors all over the country. I also produce a cream, Chara Omni, that's also on there. And my memoir, Tiger of Beijing, is on there. I founded an academy, American Academy of Integrative Cell Therapy. I do a lot of education for physicians. We have an in-person certification program. So all those things are on the website.
Heck yeah. All right. Well, thanks for hopping on. And yeah, we'll do some other episodes too.
Thank you.
Cool.